My name is Philip Moens. I'm appointed as an associate professor at the University of Leuven in Belgium, and I'm also working as an advanced practice nurse at the University Hospital in Leuven in the adult congenital heart disease program. Actually, when a child is growing up, the body starts to function differently than in childhood, which means that those patients are in need for physicians who are trained in taking care of adult patients with congenital heart disease. Comorbidities is another issue that is more prevalent during adulthood than in childhood, and therefore physicians should be trained to take care of this. But when a child with congenital heart disease is growing up, they need to gradually take up responsibility for their own care, and therefore it is needed that they are knowledgeable about their medical condition, but also about health behavior that should be adopted, health behavior that should be avoided, etc. Transition process means that a person, an individual, a child with congenital heart disease should be prepared to take up the responsibility, should be prepared to be eventually transferred to another program, to an adult congenital heart disease program. This phase of preparation, which takes on average about 4 years, this is called the transition process. It's important that institutions have developed a formal transition program to prepare the children to go to the adult-centered healthcare. But so far we do not have data on what the current practices are in terms of transferring and transitioning patients from pediatrics to adult-centered healthcare. This is precisely the reason why we initiated a survey, which is currently in process in Europe in collaboration with colleagues in the United States, and we would like to explore what the current practices in this field are, and we expect that the results of this study are ready by the end of this year. It is obvious that congenital heart disease requires an interdisciplinary approach, and in these terms the medical professions that should be included in the management of these patients are cardiologists, anesthesiologists, pediatricians, anesthesiologists, etc. But it's not only an interdisciplinary approach, we also need a multi-professional approach. So it's not only the doctors, but also health psychologists, social workers, advanced practice nurses, and so on that should be involved in the care for these patients.